the comfort to a patient knowing that, you know, we're going to do everything we can for them, and we expect a happy delivery and a wonderful experience. But if something is at risk, that we can take care of it. If there was a baby who needed additional care beyond a standard nursery, which we also offer, we would have to transfer the baby to another hospital, and the mother and the baby would be separated, or the mother would leave early. Not an ideal situation. She's recovering and she has to traipse over to another hospital. So in this setting, the mother can recover, the baby's getting care, and then if the baby needs additional time and the mother doesn't, the mother can basically room in with her baby at the NICU. She's not separated. She has a room. She has price. She's not just visiting every day behind a curtain. MFM is maternal fetal medicine. So they're the high-risk obstetric doctors, and they offer services here. So we can coordinate with those doctors with a patient who may have risk factors, or we're anticipating there may be issues, and we can, there are times when they're keeping a close eye and we're keeping a close eye and everything's fine, but there are times when we're keeping a close eye, and so we send them to the specialists and they say, you know what, this is indicated now, we need to deliver. And we have the ability to intervene earlier because we know that we can offer care to both the mom and the baby here, whereas we don't have to. Now, if we have to intervene otherwise, we have to plan to go to another hospital. The whole birthing experience that you expected and planned for and trained for and did your classes for is suddenly, no, you're going to go here now.
That's a nice.
So everything's here. It's all centralized, and we can coordinate where the maternal fetal medicine doctors are here. We're talking to them. They're down the hall. We're in the same office. It's one end of the fourth floor is the office, and one end of the fourth floor is the hospital. We can do surveillance and additional monitoring between us as well, which is convenient and just makes life easier, especially when you're dealing with something that is not such a comfortable situation. Well, we offer the tours so people can see what this is like, and the patients have had a phenomenal response to that. It's very interesting to see the patients who are not sure where they're going to deliver, and I say, well, why don't you take a look at it and see what you think, and they come over and they're just blown away. And it's not that it's it doesn't look like a high-tech facility that nobody else has, but it's comfortable, and it's large and it's roomy. It's, you don't realize that when you're delivering, it's not just delivering a baby. You have family here, you have visiting people here, your children might come. For everyone to be cramped in and for you to be uncomfortable and not have room and feel like it's closing in. It's nice to have space. There's a lounge. There's a big bathroom for everyone to use. There's the comforts of home that are here. Potential patients have an opportunity to meet the nursing staff, which they've been phenomenal for us from the standpoint of physicians, but the patients have said such wonderful things about them as well.
So it's not just the whirlpool tub.
The whirlpool tub is kind of enticing, but when they see what else is here other than the whirlpool tub, primarily the nurses, the nurse practitioners who are specially trained nurse practitioners who attend every birth, and we've had perfectly normal pregnancies come in with unexpected findings on the babies that the nurse practitioners were able to pick up, and there have been some serious findings that required additional evaluation, and it was picked up by the nurse practitioners, and those are babies that could have potentially had catastrophic events if they had gone home.